Welcome to Knowledge on the Go, the podcast brought to you by the Performance Improvement Collaborative and Knowledge Transfer teams at Vizient. I'm Carolyn Helfenstein, Senior Director of Knowledge Transfer and your program host. Today, we are digging deeper into how to create joy at work, and it is GROSS.
GROSS stands for Get Rid of Stupid Stuff.
That's Dwight McBee, Chief Experience Officer at Temple University Health System in Philadelphia. As participants in the collaborative, they saw the impact of implementing this simple idea.
Getting rid of stupid stuff sounds like a simple idea. Let's just go out and talk to our staff and see what's really making them crazy. You know, we add things all the time in healthcare, but how good are we at taking some of the things away that we've added? We don't go and reevaluate anymore. And so getting rid of stupid stuff is a purpose. It's a purpose in getting after those things that we've added and really haven't reevaluated.
This somewhat low-tech idea to get rid of stupid stuff had its origin in a high-tech disruption, the implementation of a new electronic health record.
Back in 2016, we implemented a new electronic health record. What we didn't do was go back and reevaluate and say, wait a minute, that makes absolutely no sense at all. How are you guys continuing to do this?
Mark Meyers has a doctorate in nursing practice and serves as Temple's Director of Performance Improvement and Healthcare Informatics.
And a lot of the reaction was, oh, we didn't know we could change that. That's what the essence is to really get out there with the staff, to interact with them, to understand the things that we can change that they might not even know that they could change.
One particular stress point, medication administration, stood out.
What we were finding is that the nurses were spending an inordinate amount of time preparing the medication. We were able to take our healthcare informatics team to get in there, identify, map out the workflow process, and actually change it. And what we were able to do is really make an impact for the staff that really relieved some stress from the staff to make sure that it was easier for them to accomplish the task and to care for their patients easier.
That's how Temple initially got started getting rid of stupid stuff. As Dwight McBee recalls, from there, the effort turned its focus to getting the leadership team on board.
Many of us in healthcare already have leader rounding in place. And so we're not adding anything when we talk about gross leader rounding. We're thinking about the focus of those rounding efforts. And so gross leader rounds, getting rid of stupid stuff, simply is adding context, adding a frame to the rounding efforts and empowering our leaders, equipping our leaders with a focus on removing added stressors. Those things that we in healthcare at the top levels of the organization don't necessarily think about when we start new projects, when we initiate new programs. We don't think about the downstream impact and how that adds to an already frustrated workforce. And so what we did is we took a look at our culture of safety survey and those outcomes, and we presented those outcomes to our leaders, and they saw that we have a stressed out workforce. Those nurses and residents and clinicians that were closest to the action, closest to the front lines, were the most stressed out. They were telling us that we really needed to do something to reduce stress. And so that's how we created a burning platform. We took a look at those outcomes, we shared those with our senior leadership team, and we said, this is one thing you can do. You can add a frame to your already existing rounding efforts and really start to eliminate those stressors that are currently in place in the clinical environment.
As Dwight says, the best way to summarize the information for leadership, recommend solutions for the stressors, and report back to the clinical units are still works in progress. According to Mark, the staff reaction is,
they will frankly call you out if you haven't fixed what they talked about, but they will also congratulate you and give you that feedback if you have. So it's really rewarding, and it holds the leadership accountable to make sure that they're getting the things done that they say they're going to do.
Gross is serious work. In Temple's case, as Mark says, sometimes doing the right thing in one situation has unintended consequences.
We did a great job with inviting patients' visitors into the hospital. We extended our visitation hours to 24 hours, and here we are in a poor urban environment, but really doing some of the best practices in healthcare now, which is extending our visiting hours and allowing patients to have support people 24 hours a day. What we learned, however, though, is that there weren't enough rules around when people were in after hours and what we could do, and our workforce said, that's an added stressor. It wasn't just on one unit. It was on several units that we heard that we weren't clear enough when we set out to do something great, which is extend our visiting hours, but we needed to do it a little bit more thoughtfully from their perspective. We learned that and we changed that, and they've been happy, and we've had really great feedback from our staff as a result of implementing that program.
Another thing we learned out from looking at the different departments that we were talking about through gross rounds is that we were noticing that we weren't tapping into the collective knowledge of our staff. We have staff that have worked in other organizations, and how they use their electronic health record was important for us to understand, so that way we can incorporate some of the best practices that some of those hospitals are using at other organizations.
Physician feedback was also sought. Dwight shares this example.
We have discharge instructions that we give to our patients. Those discharge instructions come from our electronic health record, and they come in a few different languages. But if for some reason our patient doesn't speak the language, our physicians have to go and find an interpreter, wait for the interpreter, make sure that they're present, and then go through the instructions for our patients. But what we didn't realize was having some limitations in the language support in some of these documents was a stressor for our physicians. We took that feedback and began to work those issues. And what we found was that the fix was relatively easy. It was simply being aware of the issue and adding some additional languages to support some of the documents that our physicians were most frustrated by.
Getting rid of stupid stuff makes a big difference. How are organizations tracking and measuring their efforts? Dwight and Mark agree at Temple they are just beginning to tackle this part of the work.
Keeping track of stupid stuff, I think, is the next stage of what we really need to focus on. There's a lot of added stressors in our environment. We as an organization are looking to create more structure around gross leader rounds and develop some metrics that can point to not only how many things we've been able to fix, but also what some of the quality outcomes are as a result of us fixing some of these issues or addressing some of these stressors. Because we know that when we start working on burnout, we start working on compassion fatigue, there is a connection to the quality outcomes that we measure every day. So we're just beginning the measurement piece of this, but we hope to have more structure as we continue to work in this project.
And on that vein, I think you really need to remind the staff of the stuff that you have done as well. Sometimes when you fix a process and you make it better, they may forget about it, for lack of a better term, which is not necessarily a bad thing. But when you're getting into employee engagement surveys and culture of safety surveys, it's important that you're also feeding back that information that's saying, from a leadership perspective, I'm listening to you, I'm understanding what you're saying, and we're working hard to fix these things for you.
Within the Joy of Work Collaborative, teams determine their own measurement, such as staff-led task forces or staff-led initiatives. The team from Temple plan to keep on getting rid of stupid stuff. They share these thoughts for those just starting to get gross.
You want to make sure that you're giving that feedback back to the staff. Keep it in small bites so that you can get through it. The feedback to the staff is really where it's at.
Getting rid of stupid stuff might be gross, but if you ask the team from Temple, it's pretty great too. Thanks to Dwight McBee and Mark Meyers, and to you for listening to our podcast. We'd love to hear from you. Drop us a line at knowledgetransfer@visientinc.com. From Knowledge on the Go, I'm Carolyn Helfenstein. Remember, knowledge is transformational. Share it.